Okay, so today we'll be doing a central line dressing change. One of the first things you want to do is obviously identify you have the correct patient, name, date of birth, look at the wristband, match it to their MAR through their charting system. And so you're going to come in with your supplies. You'll come in with your central line dressing kit. Obviously this one has been opened. New one will be sterile. A set of sterile gloves in your size, and then a set of clean gloves. I'm already wearing them. I prefer to wear a size smaller because then there's less, kind of getting in the way. So first thing you'll do is perform some hand hygiene, put on your clean gloves, and then we're gonna go ahead and remove the dressing and get our sterile workplace set up, okay? So I usually get my sterile workplace set up first at a bedside table next to me. Remember, if you turn away from your sterile workstation, it's no longer sterile because you can't ensure that everything in it remained clean. So when you open this, you want to open it in a way that you're opening away from you first, so that way you're not crossing over your sterile field. So open. All right, and now this is going to be in the table next to me, so that's no longer going to be a concern of mine. So now to remove my dressing, one of the cool things about these new CHE dressings is you can actually take and kind of rub your finger across, and it will start rolling up and make it easier for you to remove the dressing, rather than trying to pinch the patient's skin. Nobody likes that. When you remove this dressing, you always want to remove at the direction of the insertion site. You don't want to pull away because you may pull out this PICC line that has been strategically placed in the patient's mouth. Now notice this new CHG dressing, it kind of seems to pull. If it really is pulling too hard and it's hurting the patient, one of the things you can do is take some sterile normal saline and just squirt you a couple drops on there, okay? Okay, so we're just gonna carefully keep removing this dressing. And now I would have used my normal saline, obviously, to do that. Okay, so the dressing is off, my workplace is set up. So now I'm gonna go ahead and put on my sterile gloves. I'm gonna move this temporarily so you can see better. One of the things I found is at this point my hands are pretty sweaty. So I'll get my sterile gloves set up, keeping in mind you have a 1/2 inch around each edge. And I usually will keep my clean gloves on at this point because then, the sweaty palms are not a hindrance to me. Okay, I'm gonna move this out of the way, make it more convenient for you to see me. Okay, notice I was very cautious of where I was touching with my sterile fingers. Okay, so first thing I wanna do is I kinda wanna get my station set up. I wanna be able to see what I've got. Here's obviously the mask that would have been on myself and the patient. I'm gonna get rid of that. Okay, so now I can see everything I'm working with. These are already open, but this is where I like to open and kind of prop up my benzoin, my alcohol, and get my chlorhexidine kind of all close together so I know what I'm working with. First thing you're gonna do is you're gonna take your alcohol swab sticks. This pack is a pack of 3. So you'll take your first out. Obviously this is not new, but you'll start here at your insertion site and you're gonna work in like a circular motion, okay? Discard. So you'll do that 3 times, making sure it's all clean. I'm going to take my chlorhexidine, I'm going to pop it, and I kind of like just push here, make sure it's wet. And then you're going to scrub the area. The thing with chlorhexidine is really cool, unlike the alcohol, you can scrub side to side, back and forth. You really want to make sure you're getting in there good and getting it clean. So you actually want to make sure you're scrubbing on the PICC line itself and come out just a little bit. Give yourself the best really possible. Sometimes, the patient complains that this kind of hurts them a little bit, but you know what? The CLABSIs, we can't afford a CLABSI. Those numbers don't look too good. So we'll discard that. I left my stat lock on this time. I don't have a replacement stat lock. You're gonna replace that as you do your dressing. So I'm just leaving it on for the time being. Okay, so my hands are still sterile. I've cleaned the area. I'm waiting on it to dry, 30 seconds typically. You don't want to wave your hand around. or blow on it for sure, because that's just gonna put dust particles right into your sterile site now. So letting that dry. Stat lock, we're gonna go ahead and change that if we have it. Like I said, we don't have one in this set, so we won't. So next thing I'm gonna do is go ahead and get my benzoin swab stick here. Going kind of around the edge of where my dressing is going to go. Some people like to fill the whole thing. That's not really necessary. This really helps it stick and create a good seal. So I go around your edge, discard this in the trash. So now the next step is going to be get a new dressing. Notice with this, like I said, the CHG in the center, you want to make sure that's pretty centered up over your pick site. Over here. You don't want to pull too tightly because that does not allow room for your pick. See how, you know, your pick 3-dimensional dressing. So I'm gonna make sure all of my lumens are lined up pretty well. I'm gonna put my lumens in the middle of my little V here and get my CHG site right over the center. And I'm gonna start at the center and I'm gonna work my way out. Okay, this is gonna ensure that we have the least amount of wrinkles and everything. Okay, so now that my dressing's down, I'm gonna go ahead and mess with my lumens. Okay, get them all situated, make sure I have a nice tight seal. Okay. I can't get it. Here we go. Peel off the paper around my dressing. Maybe. I've learned at this point too, I always like to have 2 people in the room with me because it never fails. You need a runner or you need someone to hand you something or drop something in your sterile field. They're always a great person to have on site. With these, you know, if you just kind of take 2 fingers and lift, maybe, and lift, it just kind of slides right up in there. And now you're protected above, below. We're gonna take our name and date, put it right over top, and now you've secured and sealed that area as well. Go ahead and sign your John Hancock there, you've earned it. Today is the 7th of April, and you wanna make sure you have a date or a time as well. If you don't put all 3 of these, you know, nobody knows how long it has been since you've done it. Part of the process too is every time you do a dressing change, you see these little white and blue filters here. I'll go ahead and take this off just so you can see. These little white and blue filters, you want to change this every dressing and then after every blood draw. Because if you do it before the blood draw, what happens is you're drawing the blood, you pull it back out, you waste, you get your blood, and you can flush all you want, but you're not ensuring that every single blood particle is out of this filter. And that's a risk for infection. So you want to make sure you do it after you draw your blood. So what's going to happen is you're going to have your saline now. I'm not actually going to flush into it, but we'll take off our Kuros cap. We'll have a new white cap. Okay? You're going to make sure this is clamped. Should be clamped already, typically, if the person before does their job right. So now that it's clamped, I'm sure I'm not going to get an air embolus, so I'll go ahead and pull off my white cap. Okay? Put my new one on my flush it through, and then I'll put my new cap on. And then put a new Kuros cap on to ensure decreased infection risk. All right,